when I was 5 weeks into the treatment, and I was not able to eat, and I was, very sick and feeling very down, and just wondering, can I go on? I didn't even have the energy to walk out to the porch that I'm sitting on right here. And can I go on? And I heard a song, and I looked at my wife, and and felt like, I have support and family here. I want to, yes, I want to continue to go on. And I'm highlighting this, Shiri, because it's like I remember that so well, that depth of depression and sadness and difficulty and grief actually showed me that I have more capacity than I believe I have.
Welcome and shalom, fabulous coaches. This is another episode of Beyond Circumstances, where we get curious and playful with crisis and challenging circumstances and what it means to rise above them, go beyond them, any kind of interaction, relationship we have with them. And today we have with us Dr. Patrick Hanaway. Welcome, Patrick.
Hello.
Wonderful to have you. So we met in the U.S. in May. It was a work thing. And I got to meet a doctor that likes coaches and has experience working with health and wellness coaches. And then, so we were part of a project where we co-created something, and I saw you working with other clinicians, and we had a few conversations. And I remember one thing that I felt was I remember this during one of the days, I looked at you and I was looking at your body language, and there was something about your body language. And I said to myself that if you were my doctor right after I was diagnosed, I wonder what my journey with my illness would be like. Because my first interaction with the doctors that I met when I was diagnosed, oh my God, that was rough. It took me years. Yeah, but some doctors are like that, okay? Not every doctor. Mine were at the beginning. And now I learned how to create a medical alliance. I learned how to work with my doctors. But I just thought, if I would have met a doctor that could mentor me through that, wow, what could have been possible back then? So I said, okay, I have to invite you to the podcast because we're talking about circumstances and beyond and crisis and everything in between. And we're talking about life. So, Patrick, tell us a little bit about who you are, where you come from, what you do, anything that you want to share.
Well, the little bit part, where do I go? Thank you for that kind introduction. Appreciate that. The thing for me is I went to medical school now, as you can see, many, many years ago, and I thought I was going to learn about health and wellness. And that wasn't what I learned. And I was kind of disappointed, and I thought maybe I shouldn't do this. But I decided that I wanted to be able to help people in a way that I knew that the doctors could, and continue to search and learn. And that's what my career has been in integrative medicine, functional medicine, looking at root cause, being able to go forward. Met my beautiful wife, who's a physician, in working in a community health center focusing on health promotion and disease prevention. And we went on from there. We started our own clinic here in Asheville, North Carolina, beautiful place. And I've worked in the clinical setting. I've worked as an educator. I've worked as a researcher started the Cleveland Clinic Center for Functional Medicine in 2014. And there we started with, one doctor, one nurse, and one nutritionist. And in 2 years period of time, we had a small little corner office where they could hide us. And in 2 years, we had built out a 17,000 square foot space with 63 employees and 10 clinicians and 5 coaches and 5 nutritionists, and worked together as a team. And we're able to do the research as well as the clinical care that demonstrated that when you listen to people and you care for them and you use a team, that you get better outcomes than you do if you just go to see the doctors at the Cleveland Clinic, which is a pretty high standard. But we were able to show that and publish that in JAMA, and so that's part of the journey. I've been supportive of coaches. I've worked with them both offsite and in clinical practice, one-on-one, and they have amplified my capacity to help people incredibly. So that's a little bit about me. And as we move on and talk about crisis, I also talk about my own personal opportunities to learn.
I'm curious. Before we move on, can you say something about, a few words about functional medicine? Just, if there's someone out there that isn't really clear about what functional medicine is.
So functional medicine is a system of thinking that looks at the various functions within the body, assimilating nutrients, defense and repair, transportation, communication, energy production, detoxification, infrastructure. We see these functions in every level of our lives, but as a functional medicine doctor, looking at the root cause of illness and working to bring balance back to the system, we focus on those functions rather than on symptoms or diseases.
So let's dive right into crisis, shall we? Okay, because, we started with function, and crisis kind of affects our way to function. So what is one thing, from a personal perspective, a professional perspective, what is one thing that people get wrong when they try to manage a crisis or move beyond a crisis?
I think the biggest issue is about reactivity. Like, we react to a crisis. Generally, a crisis is not something that comes out of nowhere. There's uncertainty in life all the time. When we think that there's certainty in life, then when something unexpected happens, we move in reaction to it. And yet this is just the way in which life unfolds and works. So if we recognize that, things are going to happen, our lives literally change by a phone call. A phone call can happen. You or I could get a phone call right now from someone that would change our life forever. And we see that. So that we call that crisis. And yet it's like, oh, this is life and how it unfolds in its uncertainty. How do I dance with this? How do I move with this? How do I flow with this so that I'm actually in working to maintain balance or return to balance? And so this sounds conceptual, but what that means in practice is that if I get that phone call, or there's something that emerges that was completely unexpected, how do I find my center in that? How do I take a breath and allow myself to be present with what's happening? And I can think of many, many examples, but people note when I spent 12 years working in the emergency room, that when the crisis would hit there, Patrick would get quieter and quieter, and that was what helped me to be able to really listen to what's happening in the field, in the world, to allow me to do the best job possible.
Yeah. Now, people will say it makes sense to be reactive when there's a crisis because I need to fix it. I need to do something. And, what you're saying is, hold on. Okay, hold on and do what before you get reactive?
Well, I would say hold on and breathe. Take a breath. Find your center. Find my center. Where am I coming from? Because if I'm coming from a place of reaction, I'm not actually going to do the best job that I can. I'm not going to be able to listen to what's happening in a good way. If I'm focused on fixing, then I may be focused on fixing what I think the problem is without actually really understanding what the problem is. We see this commonly. I'm fixing what's bothering me, but that may not be what's bothering the individual or the person. Or, you give a diagnosis of cancer, like where that person goes when there's that understanding. You know, um, you have to say, where are you? What are you feeling? Because it can be sadness, it can be overwhelming grief, it can be fear, it can be anger, just as examples. So
Yeah.
how do you have to, the way to help that person is to be able to listen to them and allow them to express and create the space, to let them know that they are heard and cared for, and then move forward together from there. Not taking the heroic, oftentimes doctor stance of, I'm going to fix this. That isn't really the best way to be able to bring balance back to the system.
Yeah. And oftentimes people I find have an idea of what needs to be fixed and how. And again, we're not talking about intensive care, someone comes after a car accident in a coma. This is not what we're talking about. We might be talking about the aftermath of that. And still I find that people have a general idea of what works for them and what doesn't. So as coaches, we know that we shouldn't step into that fixing mindset, yet in health and medical coaching and wellness coaching, we're often so tempted because,
Well,
you'll,
and sometimes invited or expected to do
yeah,
that. Even more difficult when it's like, "Well, I've shared this problem with you. What are you gonna do about it?" And it's like, oh, actually, I can't do anything about it. I can help you to be able to work through the options and the opportunities, and I can be a guide and a friend on the journey. But I can't do it for you. I can't do all the heavy lifting.
and nobody can heal in your place. That's a journey that you need, you know, to walk step by step. So, you mentioned a lot of emotions. Emotions are messy. So if when we're working with people in crisis, how comfortable do we need to be with emotions?
I think we first have to be comfortable with our own emotions. We have to have awareness of our own emotions and what's going on. So before we focus on where the other person is at, we have to recognize that we're a part of the emotional field. And if someone says something, you share something with me, and I'm afraid, I don't know how to take care of that. It's actually in the field. It's already there. They know that. They sense that. And we oftentimes say like, well, no, I'm pretty good at being able to cover my emotions. And I say, no, probably not. Not as much as you think you can. And so first being comfortable with our own emotions, then moving into that place of of care and openness, and and in that way we could call it curiosity, but it's or wonder, but it's I care and I want to know how you're feeling. I want to be able to hear your expression of what that is. Many times, as we both know and we've both done, we project what we think that person is feeling rather than actually listening, asking them and listening. And as we find in any kind of interaction, any kind of human interaction, is that when we listen to someone's emotions and where they're how they're feeling and where they're at, and they feel accepted, those emotions change and move dynamically. They're not static. And so creating the space for hearing where someone is at actually allows them to begin to let go and move on to have other emotions and other experiences and begin to find their path towards healing and balance.
Yeah. I really want to echo, what you started saying by, when you said that being able to be with someone else's emotions begins with being able to be with our own emotions. So I can't have empathy for someone else if I don't have empathy for myself. And for me, I find a few things. First of all, it's the ability to name the emotion. So we need a vocabulary here. And I think a lot of us don't have names for emotions. So, we confuse them with sensations. Like, how are you feeling? Yeah, I'm feeling down. Well, down is not an emotion. Down is a metaphor, okay? Or I'm feeling tight, or I'm feeling, pressed, or I'm feeling stretched. Those are sensations and metaphors. Great place to start. But then the invitation, okay, so does that belong in a feel-good emotion or an emotion that doesn't feel good? Does that belong in the department of frustration or sadness or fear? Let's start, calling a thing by its name, because if it doesn't have a name, how can we start communicating with it? We can't just say, hey, you, emotion, what's up?
So I want to caution too about,
Mhm.
sort of dichotomizing the feel good emotions and the feel bad emotions, because they're just all emotions. It's the dance that happens. So like when we look at Chinese 5 element medicine, and we see the cycle that happens there, we talk about happiness, but compassion and warmth and connection. We talk about grief and awe. We talk about fear. We talk about anger, and there's a dynamic play. When we watch little kids, we see like they're dancing through those emotions all the time, very quickly, because they're expressing them and moving forward. It's when we get stuck in that one emotion, and I've seen people stuck in, thinking that everything's supposed to be happy. It's like, nah, that's actually not how the world is. There's a dance of all the emotions. Let's engage and interact together so that we can find balance and be our whole selves.
And I want to take that distinction. You said, let's be cautious about, that dichotomy. And I know one of the most popular dichotomies is positive emotions versus negative emotions. And I like to say there's no such thing, the only human emotions. Some of them feel lovely and cozy and fluffy, and others not so much. But they're not positive or negative. They have a purpose. They're part of our growth.
Exactly. And from I've worked with indigenous peoples and received teachings, and one of the teachings in that is like there is a meta emotion of joy, of connection, that happens through all of the emotions. It's possible to actually have that that uh, awareness and acceptance and joy in the expression of grief. Grief is one of the most, the longest lasting emotions. And yet it's an indication of the depth of love. And it's a special human emotion that we have to be able to deeply connect with each other and move through life. So, it's like there's not positive and negative emotions, as you just said. I agree 100%.
I like to think of emotions as being complex, not complicated, but complex, meaning that they're not, either or, and it's not just one thing. One thing I do find a lot is the need to think positive and feel positive when one is dealing with a medical or health crisis. There are a lot of beliefs that come with it, that if I feel negative emotions, if I allow anger into the space or I acknowledge fear, then my energy goes down and something bad's going to happen. I always have to, like with breast cancer, it's always, the pink boa. Yeah, pink boa is lovely. It's just not the only emotion out there, okay? So there's this need to manage the emotions. And I don't think we can manage emotions. I think we can manage ourselves. We can allow, to what extent are we allowing ourselves to feel the emotions? But, what are your feelings about, managing emotions and that?
Well, I'll just go with what came to mind when you said that. And I said, I've had my own personal medical experience, and we haven't gone into this, but 7 years ago, I was diagnosed with stage 4 laryngeal cancer, and didn't, it was in my face, stage 4 metastases in my throat, here, or in my near the vocal cord. And what came to mind when you said that is, I received radiation and chemotherapy. I did nutritional work. I worked with acupuncturists. I did some spiritual shamanic healing, many different aspects, frequency specific microcurrent and different kinds of tools that were available, and all of which helped. But, invariably, when I was 5 weeks into the treatment and I was not able to eat, and I was, very sick and feeling very down and just wondering, can I go on? I didn't even have the energy to walk out to the porch that I'm sitting on right here. And can I go on? And I heard a song and I looked at my wife and and felt like I have support and family here. I want to, like, yes, I want to continue to go on. And I'm highlighting this, Shiri, because it's like I remember that so well, that depth of depression and sadness and difficulty and grief actually showed me that I have more capacity than I believe I have. And so it allowed me to go forward in a way and allowed me to connect to people when they have that feeling. It's like that feeling actually is one that's like, I'm gonna make a decision to go forward in my life. Huge decision. I'm gonna be, coaching you and walking with you and saying, yes, yes, that is exactly the move to make, because life, there are going to be challenges. Moving forward and recognizing that I have more capacity than we possibly imagine. That is important. And that is what it's important from my perspective to bring forward as a healthcare practitioner, as a coach.
Yeah.
You're guiding and supporting people in that journey.
Yeah. You're talking about moving forward, and I think moving forward is possible when you move through the emotions. You don't move, above them. You don't move beyond them. You move forward with them. I know that with my medical crisis, um, and I was diagnosed with pulmonary hypertension, and got a very, very bad prognosis. That was over 20 years ago. The shift for me was about choosing to live, not just stay alive. And to do that, I had to come to terms with the fact that I might not live and really give myself permission to grieve that and sit with the fear. So, oftentimes we say, hold the space for an emotion. Holding the space for an emotion is allowing yourself to feel it and know that you are not the emotion. The fact that I'm feeling sadness doesn't mean I am a depressed person. The fact that I'm feeling fear doesn't make me an anxious, doesn't mean I have an anxious personality. But there's no managing the emotions. There's learning from them and managing ourselves. The managing ourselves is the way I choose to be with the emotion.
There's an additional piece that I want to add, and that is, that aspect of the unknown and of uncertainty. And what I've experienced is that there's actually a greater aliveness in that place. That it's not conceptual. It's that I'm opening myself up to the unknown, to the uncertainty of life. And and that's a place that when I touch it, it's just like all of a sudden my vision changes, my experience of the world changes. And but I have to be willing to go to that place of uncertainty, of unknown.
I think that's one of the most difficult things I know for coaches, but I suspect also for physicians. So, you know what?
Maybe more so for physicians. I mean, because it's trained in us. Don't go there. Be certain. You know. But if you're the one who knows, well, sometimes you got to know that you don't know. It's like being aware of that. That's that's powerful. Because if you pretend that you know and you don't, that's dangerous.
That's dangerous. So how, if we were to give some tips here, to people that work with people, whether they're physicians, clinicians, health medical coaches, wellness coaches, what are some tips that we can give them to help them be with uncertainty when it comes to them, and also hold a space, like be with uncertainty that the people that they're working with are experiencing?
Well, I think there's some tips, but I think there's first an attitudinal awareness
Yes.
that has to do with humility. You know, humility, not hubris. Being able to work, and that when difficulties come up and fear begins to arise. Fear of the unknown, fear of the other person's assessment, fear of your own inadequacy, fear of the unknown. When that comes up, say, okay, now is the time for me to find and work with courage. That those are, to me, are the big things, and as well as gratitude. Those attitudinal things will make a huge difference in being able then to listen and be present. And that on the practical side, it's as you begin to talk, you'll first breathe and then focus on listening. When someone's talking, it's like, why is this the important thing that they're telling me right now? As opposed to the way in which we are taught, it is like we listen as a medical professional, we listen to answer. It's like I'm trying to find what the question is that I have the answer to. And in fact, even in training, we often like if some doctor asks us a question and we don't know the answer, we give an answer that's related to it, to prove that we know something. And it's like, that's just kind of crazy making because, it's like, um, gosh, I don't know, and I'll find out. I'm not aware of that. I've never heard of that before. I have some thoughts on how to work with the overall issues that are happening for you. Being able to be humble and being able to say, I don't know, and opening yourself up to deeply listening. Did an exercise at the Institute for Functional Medicine conference. They asked me to speak about listening, which is kind of ironic, right? To talk about listening. And it was a beautiful, I had like 400 people. We spent an hour and a half focusing on listening. And I had people who
So
came up and
important.
said, who've been clinicians, it's like, I've never listened in that way before. I've never opened myself up to deeply listening to someone else. And I think that's the biggest, if I can give any, it's about slow down and listen. And so here's some little um, factoids, if you will. It's like we listen at at 400 words a minute, right? But we
Okay.
we actually talk at about 125 words a minute. But we think at 900 words a minute, right? So if I'm thinking at 900 words a minute and I'm speaking at 125 words a minute, that means that only about 15% of what I'm thinking I'm speaking, right? So if I actually create space in listening to allow you to really find out what it is that you have to say, the totality of the picture, not just the first thing you grab, then I've opened up a space for you to begin to explore or where you're at and to be heard. And it plays itself out, as we said, through the dance of the emotions, because there may be an initial reaction that goes on from that person you're speaking to, who you've said you have cancer or you have, a pulmonary hypertension. But then there's the exploration to allow that to be learned and understood of where that person's really at. Then, as a doctor or as a coach, then I can begin to help them. Then I can work with them. I can walk on this journey with them. And it's not my agenda, it's their agenda.
Which is so important. I also find that, uncertainty can be a very overwhelming experience. And oftentimes what we do is we go to the future, and the future is unknown. I mean, there's a lot of uncertainty there. And then we go to the past, but, the past doesn't exist. And uncertainty is an invitation to practice presence. Be in the, and the best way to do that is notice right now what you are certain of. And you begin with breath, inhaling and exhaling. Okay. And then you look around. What is it I'm seeing? What is it that I know to be true, even when everything else is uncertain and unknown? And sometimes it's simply my desire to live, or the love that I have for people, or my faith. When you create clarity around that, everything else falls to place. And then you can invite that curiosity to say, okay, so what can be born out of uncertainty? What are the new things, the new perspectives, the new possibilities? Think about creativity, thinking outside the box. uncertainty is a really lovely sandbox for
It is.
creativity.
It is. It's so beautifully said. And to me, curiosity has a little bit more of a kind of a mental, intellectual note to it. But wonder is the word that I like because
Like that.
that actually is open. You know, curiosity can be incisive, whereas wonder is sort of never incisive. It's opening.
Childlike, right? There's, like children wonder about everything. Like, oh, wow. I wrote that down. I think I'm going to offer that word alongside with curiosity from now on.
Yeah,
Thank you.
yeah. Well, the first thing I do every day is I pray. You know, I sit down, I quiet my mind, and I offer my prayers of gratitude and appreciation. You know, that's probably the biggest thing. Then I get up and I go down and get on the rowing machine and do some exercise, do some movement. I have particular kinds of movement that I like that are biking and hiking or walking and getting on the rowing machine. And that movement for me is very, very helpful to be able to do. So those things, you know, motion is the lotion to help move. And so it helps me to feel engaged in the world. And when I don't do that, I don't feel as good. But I also work not to beat myself up. You know, I've had a few days recently with a crisis that you know, I haven't had the same chance to move that I normally would. And so looking forward, I was able to do that today and that's key.
Wonderful. Prayer and movement. I love that. Patrick, so much. This was an incredible conversation. Thank you so much for saying yes. So, where can people find more about you, about the Cleveland Clinic, about the work that you do?
So I'm not working with the Cleveland Clinic anymore. I stopped that after my cancer, and I've continued back with working with my wife. We see patients on a functional medicine side called family to family, family to family, and we're also working on developing a process called Your Healing Roots, which is about really working with people on retreats and taking them back into connecting to the living world and being able to learn from and listen to the living world. Yourhealingroots.org is where I'd encourage people to go and we're working on our blog, which will be called The Weekly Wonder.
Amazing. Amazing. So, we'll have all of that information, for the audience to see it, all the links. Patrick, again, thank you so much. And to the audience, thank you for joining us today. If you're a coach who wants to learn how to support your clients through life's hardest challenges, tune in to the next episodes and check us out on social media for additional content and trainings. And be well, and let's continue making this world a better place.
Thank you so
Thank you,
much.
Patrick.